Hey everyone, welcome back to the channel. So today what we're going to discuss is we're going to talk about why your knee pain is most likely a consequence of something else. That often sounds a little bit strange to say, considering that most people's knee pain is very specific. Whether you've got a patellofemoral joint pain syndrome, whether you've got arthritis, whether you've got Osgood-Schlatter's, patellar tendonitis or tendinopathy, whether you've hurt your ACL, you've done a meniscus, whatever it may be, excuse me, we're very, very good at treating the knee. We're good at looking at the knee and saying there's a problem, let's get it stronger, let's free it up, let's inject it, let's do whatever we can to make that knee feel better. But we forget and we miss, and it's a crucial point to make here, is that we often think and we look at the knee as an individual structure on its own, floating around in space. We call it a knee, and this is one of the problems with the medical industry in general, is that we're very specific with things, where we say that we label this a knee because it helps communicate information. So if I tell you that you have a knee problem, or a patellar tendon problem, or a kneecap problem, I can say that to another professional and they'll know pretty much where we're treating or what we're looking at. And then we add a diagnosis on top of that to make it more specific again. And this is obviously important for relaying information, but in terms of solving the problem, it can be a real distraction because it gives us tunnel vision, or it narrows our focus to, more often than not, just focus on the label of where it is, instead of being able to take a big step back and understand the context of how that area functions. So the reason why it's important to think of your knee as a joint of consequence is because, and this isn't going to be news to anyone, your knee area is stuck in between your ankle and your hip, connected via your thigh bone and your shin bones. So it's a mechanical structure within other mechanical structures that functions as a broader mechanical system, basically. And the reason why this is an important distinction to make is that if I said to you, and I challenge anyone to do this in the comments below, tell me where your knee starts, tell me where your knee ends. And we can pick on some landmarks, we can talk about the bony bit at the top of your shin, we can talk about the actual joint itself, the top of the kneecap, the bottom of the kneecap. But if I was to say to you, look, where does the skin of your knee begin and end? It's impossible to define where that is because it's a continuous structure. There's soft tissue and fascia underneath that skin that's also continuous. Your quadricep muscles attach into a tendon which attaches to a bone. Your calves, your hamstrings, there's other muscles around the knee that cross the knee joint that also act on areas above and below that. Obviously your calf muscle, for those who don't know, your calf actually attaches above the joint of the knee and it goes down to below the ankle joint. So it has this ability to impact both joints. So to label the knee joint as just a knee, and if you have knee pain, to look at your knee pain as just a knee pain, it neglects the fact that there's all these other structures and mechanical things that can impact your knee. So the reason why this is important is because if you are wanting to cure your knee pain, or wanting to prevent it from happening, or you just want to improve the function of your legs, we have to look at you in a broader context. Otherwise we're missing the bigger picture, we're missing the point. So from my experience as a physical therapist, there's three main areas that I guess your knee cause your knee to suffer consequences, and they are your ankle, your hip, and your lower back. And those three areas, in my experience, tend to be the reasons why knees get sore. And apart from direct trauma, obviously having a fall or getting a knock on the knee or something like that, something that's more of an accident, those things are obviously in a separate category. But even when we talk about something like an ACL tear, where we're often very quick to say that it was an accident, you changed direction, you landed funny, we're quick to blame the moment. But again, if we're not looking at how the entire leg has been functioning up until that point, we're going to miss the features that set that knee up to fail when it did, as opposed to someone who has really good leg mechanics, they landed and twisted and their knee was fine. Someone who had less than ideal knee mechanics, they landed and twisted and they're out for 12 to 18 months with an ACL injury. So regardless of pretty much what type of knee pain that you have or knee injury that you have, we need to look at your ankle, we need to look at your hip, and we need to look at your lower back if we are to understand the mechanisms that have led to the tissue in your knee becoming sore and potentially injured and damaged. It's more so, I guess, if you've got arthritis. If your knee joint's worn down to a nub and you're 30, 40, 50, 60, 70 years old, that doesn't happen on its own. There has to be some tangible mechanical faults there that on their own probably aren't sore or probably don't even stand out, to be honest, that have just been chiseling away at the function and the health of your knee over time, degrading the tissue and then giving you some issues. So in order to improve how you load that knee, much like anyone else who's got a knee injury or other knee conditions, we need to look at the other areas. So why this is important is we can look at it when we do something as simple as a squat. So as you've probably seen in previous videos, or as hopefully you know already, an ideal squat requires you to have your feet straight, and it also requires you to rotate your knees out. We don't want to rotate your knees out so your feet turn out. We want to plant your feet and almost screw your knees out, because what that does is it lifts up the arch of your foot. It puts your hips in a strong, stable shape because you're using your glutes, those deep hip rotators, to turn those knees out. So in this position, you've got a really strong, stable platform to just squat down and up. And what you'll see when I do this, hopefully, is traditionally most people's knees go forwards, but in a perfect squat, your knee should actually go forwards and out. So if you've created that rotation and stabilized your ankle and your hip, the natural way that your knee should go should be out as far as you feel comfortable. Now, this is really important for a number of reasons, because if your ankle is stiff, if you don't have the forward flexion of your ankle, or you don't have the rotation needed to rotate that leg out, your body has to compensate. So how this looks, if for example, and my ankles are a little bit stiff anyway, but if for example we say that this is full range of motion, and it's not, it's probably a little bit further, and let's just say that I didn't have that, and I could only bend my knee to here. So I'm missing this sort of this end range movement where my knee should be going further, but it can't because my ankle's stiff. What that does is that every time you require more range of motion than what you have, your body has to find a way around that position. So instead of being able to consistently be in a good shape when you move, we're in a disadvantageous position where the arch is collapsed, the knee is now caving inwards, and the hip is now closing down. So if you have anything like a patellofemoral joint pain, meniscal pain on the inside, if you've had some ACL problems in the past, if you've got some ITB pain, a lot of the more sort of lateral structures, or the inner and the outer pains, are often because that leg's dumping inwards, a lot of the time because it's trying to get around a stiff ankle. So if we're not trying to free up that ankle, then we're missing one of the main reasons why that knee's being put in a bad position. So how we can change that, you've obviously seen this before, but you'll know if you follow along that I'm a huge fan of the banded ankle stretch. So we want to get the band at the base of the ankle, stretch it out as far as you feel comfortable, keeping the heel down and just bending that back ankle as far as you can. And again, making sure that that knee is rotating outwards as far as you can, and also as far forward as you can. So instead of going forwards, we're actually going off almost at a 90-degree angle, but with your foot going straight. So how that often looks, if the band's behind, is we're bending the ankle, but it's going out. We're trying to really bias that rotation at the ankle as much, or just as much, as the flexion. Excuse me, I don't know why I'm puffing, but I seem to be. But that's the idea. So if that ankle's stiff, it's going to force your knee to move in a way that it's not designed for. And then when you're squatting, instead of being able to stay in a really good, strong shape, your body's going to compensate around that, either by turning your feet out, lifting your heels up, or caving that knee in. So from a mobility perspective, ankle stiffness is a huge predisposing feature for a lot of people who have knee pain, knee injuries, but also persistent knee pain, especially something like arthritis. I'd almost be willing to bet that anyone who has arthritis in their knee like not necessarily maybe rheumatoid arthritis, but osteoarthritis, probably going to have a stiff ankle. You may not know that it's stiff, but when you try and get down into a squat or you try and do that ankle stretch, you should find that you can't go very far, or as far as you could potentially. So that's number one. So the ankle's really important. The next piece of the puzzle is the hip. And as we said before, when we're looking at this hip, the key to having a good stable knee position and strong knee function is being able to keep your knee sort of out, not for keeping it out's sake, but because keeping it out is an expression of full rotation of the hip and the ankle. And that position is a much more stable end range shape to load something up with weight, or if you're running, we want to make sure that when you're running, you're not ending up in this position every time your leg hits the ground. We want you to be able to stabilize a strong shape, and part of that comes with rotation. So if you're lacking hip rotation, the pigeon stretch or the pigeon pose, which again I think we've covered before, where again you can do this up on a chair or up on a bench, but for the purposes of this, we want to get your shin relatively horizontal, dropping that hip down, trying to keep your back nice and straight. We don't want you to be bending forward because that's not necessarily stretching anything in your hip. But again, we want to be in this position. Find something that feels tight, so you might need to sort of take your bottom back a little bit. But for me, I can feel a little bit of tightness in there, in that glute, in that back pocket area. So I want to take a deep breath in, squeeze everything, tighten up those hips, hold it for a couple of seconds, and then relax. And then what we should find is once you've done that, you should be able to drop down a tiny little bit further than before. And we want to keep repeating that until you feel like you stop making change. Because what should happen is when you put this back into a squat again, having done this side, you should then feel like you can get that knee out wider than before. And I can sort of see on the video here, that right knee goes to sort of there, that left one feels like it's going further without anything want to come off the ground. So, excuse me. So from a diagnostic perspective, if your ankle's stiff and your hip is tight and or stiff, it stops your body from being able to express normal range of motion. And because your knee is sandwiched in between those two joints, it's often the joint, particularly because it's a hinge joint, it is designed just to bend sort of in the one plane backwards and forwards. But if you are lacking the rotation at the hip, then your body's going to start sort of bending and twisting and grinding, which is one of the reasons why we see the joint wear away with arthritis, meniscal tears, patellofemoral joint pain. It's the same thing. That knee's dumping inwards, and instead of the patella being able to track in a linear fashion, it's all of a sudden having to sort of deal with this extra rotation because it's not coming from your hip or your ankle. So those two features are, for most of the knee complaints that we see, a lack of those two things plays a strong role in the onset of that pain. And obviously once it's become sore, there's a whole bunch of stuff you need to do to try and make that feel better. But if you're not also working on those sort of proximal and distal, the above and the below problems, it's very hard to solve that issue and to walk away saying, right, I used to have a knee pain, as opposed to someone who has one or used to have one, but it's now going to come back again at some point. So it's two important pieces of the puzzle there. The third piece of the puzzle, and this one's often sounds a bit strange to a lot of people, but clinically, your lower back has a strong role to play in a lot of knee pain. And it is that way for a couple of reasons. It's not necessarily directly, it doesn't necessarily create a direct consequence like a stiff ankle or a stiff hip can, where the knee is literally the next joint sort of in the middle of those two areas, so it cops the brunt of that immobility. The back's role is a little bit more subtle, a little bit more indirect, but it's still important because the lower back at the base of your rib cage and just a little bit below, that section of your spine houses the nerves that supply all the musculature in your thigh, in your hamstrings, your calves, and everything around it. So if your sort of mid to low back gets stiff, what can happen is if that does get tight, you can essentially pull a lot of the slack out of the system. So we see a lot of people with sort of the more sort of central issues like a patellar tendonitis or a tendinopathy or a quads tendon, so the tendon at the top of the knee where the kneecap attaches into your quads. if those tendons become a problem, generally we see that it's because the femoral nerve, or the quads that sort of are supplied by the femoral nerve, that whole mechanism is stiffer and tighter because it's being sort of pulled from the back. And the back doesn't necessarily have to hurt, but when we start to feel through the joints of the spine, we often find that there's some genuinely stiff and tight areas of that back that when you release them, all of a sudden you get that quad release, the hamstrings release, the calf releases, the muscles that are tight stop being tight, and that resting load goes away, or it decreases. So it's the same concept with something like Osgood-Schlatter's disease, which is the bony irritation of the tubercle at the top of the shin. We see a lot in sort of young kids. As I said, a lot of those issues in the more central line can sort of be traced back to that lower back. So what we can do for that, and I'll put a link to this. I think we did a video on this yesterday, and we'll put a link up here. You can use something like a tennis ball or a foam roller, whatever you want to use to free up that spine, feed some slack back into the knee, and try and restore some normal sort of function, or more normal resting function to the tissues in that knee. So the easiest way to do that is to grab your ball. Again, we're looking at sort of the base of the rib cage and just below. So not the low back, but a little bit higher up. You're going to place the ball in the middle and just let it roll off to the side a little bit. So not all the way out to the side, but just from the bump in the middle, just let it roll off onto the fleshy part. We're going to lie down on top of that. And all we're going to do here is just going to move the ball around until you feel like you hit something that feels tight, stiff, or tender. And then we want to stay there. So all we're doing here is just letting the ball press into that stiffness, giving it a chance to settle, giving it a chance to give. Again, take some of the slack out of that system that's sort of pulling this a lot tighter than it needs to be. And then once you feel like you've given it enough TLC, just move the ball up or down or to the side a little bit more until you feel like you find the next spot that needs a bit of TLC. And if you have, important thing to notice is if you have any of those more sort of central problems, so we're not talking about the issues at the sides of the knee, but the pain that's more sort of down the middle of the knee, you'd probably be surprised that there'll be this line of tightness that sort of goes through here, then up through your back. You may not notice it until you start digging your ball into those areas, but what you should find is if you're doing the squats and you're generating some pain here, or it just feels uncomfortable, freeing up your back and then doing that again, you should notice that there's potentially a little bit of an improvement of your symptoms straight away without having to touch your knee. So they're just a couple of things to think of. As I said, the best way to think of your knee is not to think of it as a knee at all. Think of it as a leg, and if not a leg, a lower half, because at no point is it functioning on its own. At no point is it doing something different to everything else. It's directly affected by the flexibility of your ankle and your hip, more so the rotational flexibility, but the straight movements as well are still important. You're designed to have that range of motion for a reason, so they're important. And then all that's governed by the state of your lower back, that mid to low back from your rib cage down, freeing up those areas, stabilizing them, putting them in a good position, still count there as well. So hopefully that helps give you a little bit more information on sort of what you can do and how you can do those things to help you. As always, please consider subscribing to the channel. Leave a like if you enjoyed the video. But until next time, we'll see you soon. Bye.